I'm very happy to talk about one of the new antiemetics that are directed against what we call the NK1 receptor antagonist. We have actually two that have been recently approved. One of them is indeed NEPA, which is a combination of netipitant, the NK1 receptor antagonist, and palonosetron, a 5G receptor antagonist, in one single capsule. And this one has been now approved throughout the world after registration studies. And the study that is being presented here at ESMO on quality of life is based on the data from a very large study for registration in China, directed by Dr. Zhang Li. And this study has shown, as expected, that there was a similar efficacy of this single capsule compared to a more complex regimen using the NK1 receptor antagonist called aprepitant in the standard 3-day way of using it, along with a 5G receptor antagonist and cortisone, or dexamethasone actually. And now this subset analysis shows that indeed the impact on quality of life of patients, as expected, is positive. These patients do have a better quality of life as they have less nausea and less vomiting. It doesn't surprise anyone. So that's not the big news. The big news is that we have several of these new agents available, and they are becoming more and more available in different countries. And I think this will allow many of my colleagues to follow guidelines, because the guidelines in many indications suggest a triple combination, an NK1 receptor antagonist, a 5G receptor antagonist, and dexamethasone or another corticosteroid. Guidelines are not yet followed because the old regimens were somewhat complex. The new ones are much easier, and so I hope that patients will benefit from this throughout the world.